video I will explain aftercare to you. So once you've had your treatment, your skin is likely to be red and a little bit puffy. That's because electrolysis is a heat treatment. This will last between 30 minutes and 2 hours on your skin, depending on how sensitive you are towards heat. What you need to do to reduce that effect quickly and to protect your skin post-treatment from any infection is get yourself some aloe vera gel, either from Boots or from Holland & Barrett. 99% aloe vera gel. Keep it in the fridge, it makes it even more soothing, and you can mix that with a drop of tea tree oil, which will prevent any infection from entering your skin. Make sure you wash your hands before you do that, and make sure that you check that you're not allergic if you haven't used these ingredients before. Strangely enough, there are people actually that are allergic to aloe vera. The next thing, you need to avoid any further heat from entering the skin. So avoid going to the gym, that's just for 24 hours for the gym fanatics. So no gym, no swimming, no steam, no sauna, no hot showers or hot baths. If you're still feeling sensitive after 48 hours, just extend that period for 48 hours. Generally your skin, I find, will tell you when it's ready to go back to normal life. I've always felt when after a treatment that if I think I've waited long enough and I go under the hot shower, the area will feel burning if it's still not ready to have that. So I'll just turn the temperature down. You can still have a shower, just not a hot one, that's all. The next thing is sun exposure. Please avoid any sun exposure, and that's for two reasons. The first reason obviously is the heat, but the second reason would be that the sun is able to create more pigmentation in your skin, as you know, with tanning. But when there's healing site on the skin, for some skin types, especially the darker ones, Mediterranean and darker skin types, they can actually hyperpigment in the area that's currently healing, and we don't want that to happen. It's a temporary effect, but we can try and avoid it. So if you were to be going anywhere in a hot country, make sure that you schedule your treatment 2 weeks before the date that you're leaving, or if that's not possible, then make sure that you're wearing a hat with a white brim, and also you're applying a factor SPF 50. That's also will cover you from UVA rays, not just UVB rays. You apply that on your face at all times. Keep reapplying throughout the day to make sure that you're protected. Now the next thing that we need to discuss, that is makeup for ladies that are having facial areas done. You're not allowed to put normal makeup for 24 to 48 hours on your face. The only makeup that is allowed is mineral makeup, and that's for a few reasons. First of all, mineral makeup has no organic ingredients inside that will breed bacteria, so you're not going to be contaminating the freshly treated follicles with bacteria, exposing them to possible infection. Second of all, mineral makeup has zinc oxide, and zinc oxide is drying, soothing and healing on the skin, so that will really help the healing process progress faster. And third of all, mineral makeup has sun protection also, so it has that function to reflect light, and so it protects your skin from the sun. So for these three reasons, that's the only makeup that's allowed on the skin post-treatment. Another point is just skincare. What type of skincare you're allowed to have. Non-perfumed, hypoallergenic. Make sure that there are not very active ingredients in the skincare that you're using to not further aggravate your skin and allow it to heal. So things like glycolic acid, or any acids for that matter, or retinoids, or strong vitamin C, you don't want to have in your skincare that you'll be using post-treatment. Let me see if I've covered everything. Okay, in a longer period of time, of let's say a week, make sure that you're not rubbing off. If you have any tiny scabs formed, they're normally just pinprick, big brown scales, please don't lift these. They are an important part of the healing process, and it's important that they stay there until your skin is ready to let them go. They protect the follicle from the outside world and bacteria entering into your body through the freshly treated follicle. So those will come off on their own when the skin underneath has healed completely and closed this area that has been treated. Now here I remember something else that actually many people ask for. Some people would have a red mark stay on their skin after the tiny scab has fallen off, and these may stay for actually quite a while, especially on darker skins. They can turn from a reddish mark into a brown mark, and they can stay anything between a few weeks up to 18 months. I've had clients that have had that, and it's, as I said, it's more common on darker skins, and the initial redness that you see is just the result of the healing process that's going on inside the skin, because the tissue that's been built to fill up that column of tissue that we have treated, that newly formed tissue is not as dense as the tissue that was there before. So you see a lot of the little new blood vessels that fill up that gap, and over time the collagen that's in that new tissue will get dense enough, and that redness will disappear. The ones that turn brown, for darker skin types, people just heal in that way, and if they genuinely find that after a spot they have pigmentation staying there for a long time, they should expect that with electrolysis, after electrolysis, they will have that pigmentation there, and they can help it with different products to lift faster, but it's part of the healing process. It is temporary. Even if it's there for a year, it will go away. Actually, further electrolysis treatment in the area does speed up that healing process and does help lifting that pigmentation. So please don't worry, it's normal and it is temporary. It will go away. But to help it reduce some time, again, wearing sun protection, making sure that you don't expose the skin to the sun where it's being treated, helps also a lot. What you can do for people who are prone to this hyperpigmentation after treatment is use rosehip oil. So not in the first 48 hours or until the skin's really calmed down and that heat's gone from the skin. Then you can start using rosehip oil. Try and get it normally online, try and get as good as you can, and just apply massage in the skin every evening as a night oil, and that will help the skin deal with the pigmentation quicker. But again, there isn't really any other way of doing this. I mean, okay, I work with more advanced epilator, and I also use insulated needles, and that really reduces how much pigmentation I get on clients, but still some would still get it. It's just inevitable, and it's okay. It's just part of the process, and that's fine. Okay, what else? You might want to avoid having any facials, peels for a couple of weeks at least post-treatment, to just allow, if you have normal healing, to allow your skin to completely heal and close up, and it's ready to take something like that. But if ever in doubt, please email me or call me and ask, and I'll let you know. That's perfectly fine. Okay, I think I've covered everything. I hope I did, and I hope that helps you. Please check out all my other videos, and all the best.